So lifestyle changes are very important in preventing diabetes, in the sense that sometimes you might have a family history of diabetes, but how you take care of yourself might delay the onset of diabetes or help to control the diabetes. So basically, like most of you will know, diabetes is all about sugar levels being high in your blood. So definitely anything that you take that has a lot of sugar, when we talk about sugar, it's not only the sugar that you have in your tea, but every carbohydrate, so your banku, your kenke, your rice, your brode, and all of those things are basically carbohydrates, and we call it sugar. So if you are able to cut down on your sugar intake and rather increase your vegetable intake, so then when you are eating, there's more vegetable than probably the carbohydrate, it will go a long way to help control your sugar. Then again, fruits. You know, we all say fruits are good and all, but for a diabetic, there are some of the fruits, you bear with me, are very sweet. So when you take those fruits, though they are helpful in other conditions, it might make your diabetic control a bit difficult. So that is actually very important. Then the next thing is, in terms of your exercising, we know that if you are not exercising and your weight goes up, it becomes more difficult for us to control your sugar. So it is advised that we are always, exercising to reduce our weight to where it needs to be. These are things that are extremely important. But as we speak about lifestyle, don't say, okay, me, I don't have diabetes in my family and I don't have diabetes, so I can live anyhow. When you prevent yourself from doing some of these things, it goes a long way. Now, it is also important to realize that, women now would want to become fair and they bleach themselves and all. That is one of the lifestyles that unfortunately also causes diabetes, in the sense that the creams that they use to bleach themselves to become fair, or sometimes they take tablets. And those tablets that make them become fair, and I'm sure some of you know the P, it actually would cause you to have diabetes. And then again, there are also some other, drugs that we give, sometimes even for treating blood pressure and all, that we know can also send the sugars up. So these are some of the things that we should be mindful about in terms of lifestyle modifications, which will go a long way to control our diabetes. If in your family, your parents have diabetes and you also get diabetes at age 30 or 40 and all, it is very unlikely that it will be reversed, because probably you are going to have the diabetes for the rest of your life. But if you are able to control your weight, control your diet, then there's a possibility that your doctor can reduce the medications that you take for the diabetes, and in some cases eventually put you on diet and not on the medications. Now, if your diabetes is as a result of a medication you took, or as a result of some bleaching agent you used, then if you stop that particular medication, after a while you realize that your sugars will be normalized. But generally, the diabetes you and I know that are running in families and all, to be honest, or when children get diabetes, what we call the type 1 diabetes, then it cannot be reversed. So don't let anybody deceive you that, okay, stop your medication, or there's a one-time medication that will let you go away. But rather, if we think that it's from another cause, when we stop it, then chances are that we can say that your diabetes is cured. But even with that, I would encourage you to, as and when, just check your sugars to be sure. If it is inching up, we try and control it either with diet or with the medication, or sometimes with insulin.